There's a moment that can feel slightly off, but easy to overlook. You go to the bathroom more often than usual, but not because you drank more. The flow feels weaker, slower. There's a lingering sense that the bladder hasn't quite emptied, even though you've just been. It's not dramatic, just different. Maybe later, there's a faint burning sensation or a feeling of pressure low in the abdomen, and you start to wonder, what's changed? To understand urinary infections in older men, it helps to picture the urinary system as a kind of plumbing network. The kidneys filter waste from the blood, creating urine. That urine travels down thin tubes called ureters into the bladder, where it's stored. When the bladder contracts, urine flows out through the urethra. In a well-functioning system, this flow is smooth and complete. Waste moves through, and the system clears itself regularly. A urinary tract infection, often shortened to UTI, happens when bacteria enter the system and begin to multiply. Most commonly, these bacteria come from the body's own environment, particularly from the skin or digestive tract. Under normal conditions, the flow of urine helps flush bacteria out before they can settle. But when that flow is disrupted or incomplete, bacteria have more time to remain and grow. This is where age-related changes become important. One of the most common factors in older men is the prostate. The prostate is a small gland located just below the bladder surrounding the urethra. Over time, it often enlarges, a condition called benign prostatic hyperplasia, or BPH, meaning non-cancerous growth of the prostate. As the prostate enlarges, it can gently compress the urethra. Not enough to block it completely, but enough to change the flow. Urine may come out more slowly, and the bladder may not empty fully. If you imagine that plumbing system again, it's like a pipe that narrows slightly. Water still flows, but not as efficiently. A small amount may remain behind after each cycle. This leftover urine is called residual urine, and it creates an environment where bacteria can settle. Have you ever noticed how still water behaves differently from flowing water? Movement keeps things clear. Stagnation allows things to accumulate. The same principle applies here. Once bacteria are present, the body responds quickly. The lining of the urinary tract becomes inflamed. This inflammation is what causes many of the familiar symptoms: burning during urination, increased urgency, discomfort. The bladder, sensing irritation, may contract more frequently. This creates the feeling of needing to go often, even when there's only a small amount of urine present. Another interesting detail is how symptoms can appear differently in older adults. While younger individuals often notice clear discomfort, older men may experience more subtle or unexpected signs. Confusion, fatigue, or a general sense of unwellness can sometimes be the first noticeable change. This happens because the body's response to infection affects the whole system, including the brain. Here's something many people don't realize. The immune response itself contributes to the symptoms. When bacteria are detected, immune cells release signaling molecules called cytokines. These increase blood flow to the area, bringing more immune activity, but also causing swelling and sensitivity. The discomfort is not just from the bacteria, it's from the body actively responding. Another lesser-known detail involves hydration. When fluid intake is lower, urine becomes more concentrated. This reduces the flushing effect and can make the environment more favorable for bacterial growth. On the other hand, regular fluid movement supports that natural clearing process. There's also the role of the bladder muscle, called the detrusor muscle. Over time, this muscle can become less efficient at fully emptying the bladder. Even without prostate enlargement, this can contribute to residual urine. Temperature and environment play subtle roles too. Warm conditions can encourage bacterial growth, while cooler conditions may slow it. Hygiene, skin condition, and even clothing can influence the local environment around the urethra. Here's a common misconception. that urinary infections always present with strong pain or obvious symptoms. In reality, especially in older men, the signs can be mild or unusual, which is why they're sometimes overlooked. Another lesser known factor is the role of the microbiome. Just as the gut has a community of bacteria, so does the urinary tract. A balanced microbial environment can help prevent harmful bacteria from taking hold. Changes in this balance, due to age, medication, or other factors, can influence susceptibility. There is also a connection with sleep. Poor or disrupted sleep can affect immune function, making the body slightly less efficient at responding to bacteria early on. And then there's the simple but important role of timing. Holding urine for long periods allows bacteria more time to remain in the bladder. Regular emptying supports the system's natural cleansing. The experience of a urinary infection can feel uncomfortable, sometimes frustrating, especially when symptoms are subtle but persistent. But there's a protective purpose behind what's happening. The burning sensation, the urgency, the increased frequency, these are signals. The body is encouraging more frequent flushing of the system. It's trying to clear the bacteria out. Inflammation, while uncomfortable, is part of the immune system's effort to contain and remove what doesn't belong. The body is not working against you. It's responding with precision. There are also patterns that seem to support the system over time. Gentle hydration throughout the day, regular movement, responding to the body's signals rather than delaying them. Even posture and relaxation play a role. The pelvic floor muscles need to relax for complete bladder emptying. Tension can interfere with that process, even subtly. Small environmental adjustments, comfortable clothing, maintaining warmth without overheating, allowing time for the body to complete its processes, align with how the system naturally functions. If you return to that plumbing analogy, the goal isn't force, it's flow. Smooth, consistent, unobstructed movement. And when something disrupts that flow, whether it's a slight narrowing, reduced muscle efficiency, or changes in the environment, the system becomes more vulnerable. But it also remains responsive. So when those small changes appear, the slower stream, the increased frequency, the subtle discomfort, they aren't random. They're the early signals of a system adjusting, responding, and trying to restore balance. And beneath it all, the body continues its quiet work, filtering, flushing, protecting, moment by moment, adapting to the changes that come with time, and still finding ways to keep everything moving. Here are 5 lesser known, scientifically supported ways that can help reduce the risk of urinary infections, especially in older men. 1. Double voiding, emptying the bladder twice. After urinating, waiting a moment and trying again can help reduce residual urine. Less leftover urine means fewer opportunities for bacteria to remain and multiply. 2. Sitting down to urinate. For some men, sitting rather than standing can improve bladder emptying by allowing better relaxation of the pelvic floor and a more complete flow. 3. Supporting regular bowel habits. Constipation can put pressure on the bladder and interfere with complete emptying. Keeping bowel movements regular helps maintain normal urinary flow dynamics. 4. Gentle pelvic floor relaxation, not just strengthening. While pelvic floor exercises are often discussed for strength, the ability to fully relax these muscles is equally important for complete bladder emptying and reducing urine retention. 5. Maintaining a steady fluid rhythm rather than large, infrequent intake. Drinking smaller amounts consistently throughout the day supports regular flushing of the urinary tract rather than overwhelming the bladder in short bursts. These approaches work by improving flow, reducing residual urine, and supporting the body's natural ability to clear bacteria before they can settle. I hope this has helped. Like and subscribe for more health tips.